You're watching NBC4 HD. And now, Sue Simmons, Perry Peltz, Janice Huff, and Len Berman. This is News Channel 4, live at 5.
In News for Your Health, a little boy from South Africa has a new outlook on life thanks to the kindness of a local man and a hospital. 11-year-old Vuyo Mikalapi is in Brooklyn, far from his home in Port Elizabeth, South Africa. It's a journey that began when teacher John Lombardo was on a semi-annual trip there teaching art to children.
We noticed in August that Vuyo was holding everything really close to his face, his pencils and his scissors, and we thought maybe he just needed glasses, so we took him to an eye doctor and they referred him to a specialist.
The diagnosis, keratoconus, a thinning of the cornea that causes distortion and reduced vision. The cornea becomes cone-shaped rather than rounded. Vuyo's case was so severe that glasses or contacts wouldn't be enough.
When we showed him the pictures on the wall, the best corrected vision we could get in his right eye was to the tune of 2,800. What that means is very legal blindness. He's able to do things, you see shadows and can make out visual cues and that, but other than that is very, very limited.
Vuyo needed a cornea transplant in both eyes. Not only would it be costly, but in South Africa, the wait for a cornea would be at least a year. So Lombardo asked others to pitch in. Thanks to the generosity of an airline, an eye surgeon, and a hospital, Vuyo traveled to New York for surgery that would allow him to see again.
This eye don't see.
The swelling in his left eye is caused by the disease and is being treated with medication. The first cornea that's available was for his right eye. In the operating room, Dr. Ehrenhaus first removed the disease.
All this is this diseased area, and it can actually extend down to about here. So I'm going to measure how much I want to take out to give him the best chance of getting rid of the scar, giving him a better, clearer center. I'm going to practice, see how much we need to do.
Then he worked carefully, peering through a microscope to precisely position the new cornea in place. And just 6 days later,
I feel great. I see this eye is, I don't see.
He's doing phenomenally well. He went from being legally blind, worse than legally blind if you can say such a thing, to reading most of the way down the chart, almost at the level of legal driving. He's ecstatic, he's singing, he's practically dancing, he can see so well.
It's like being with a much younger child sometimes because he's identifying things for the first time. Look at this building, look at that, look at this, and very happy just to be able to see it.
antibiotic ointment helps the healing and prevents infection. Dr. Ehrenhaus is watching to make sure Vuyo's body doesn't reject the new cornea, and now that his left eye is doing better, Vuyo should have a cornea for that eye before the end of the year.
If he continues to heal the way he does in the right eye, he might actually be spectacle-free for most of what he needs in the right eye and hopefully in the left eye as well.
I see and I want to see a left eye. I say thanks. I happy that I see a right eye.
Well, for more on this disease and overall eye health, you can log on to our website at WNBC.com and click on Health. Scroll down to our A to Z guide and eye care from the list.